Hey guys, and welcome to another episode of Coffee Chats with Toby. Today, I'm super excited because I'm going to take you through a condition that I see time and time again that comes through our clinic. So what we're going to do is we're going to have a look at knee pain, and in particular, a dreadful condition called iliotibial band syndrome. Now, this is a very common syndrome or pain that gets experienced by many clients, and oftentimes is misdiagnosed with other more sinister conditions. So basically, what we're looking at is if you have exhibited or getting pain in around this bottom, most of the time lateral or outside component of your knee, you're already starting to potentially show some signs that it might not actually be arthritis or any other more sinister conditions, and could in fact just be what we call iliotibial band syndrome. I'm going to flick over to a Google image as I explain this condition to you guys. I'm a very visual person, so I love to give you guys a picture to look at as I talk. So as you can see here, the iliotibial band, if you're looking at the left image, is that white sheath looking thing that looks to be attaching up in the hip area with the tensor fascia lata or TFL muscle attaching to it, the gluteus maximus muscle that you can see attaching to it as well. So what happens is if there's any kind of tension between the glutes or the TFL that are pulling or contracting, what happens is it draws up that white sheath that you can see there, and oftentimes pulls on the lower component of our knee that I showed you just prior. And you can see from that area that it circles there and says area of pain. Now, this can be an incredibly painful experience, and unfortunately the way that we can alleviate those symptoms is actually not very pleasant either. But simply put, a lot of people kind of struggle with this syndrome, and they treat it via doing foam rolling down the lateral aspect of their leg. And although there's been some kind of research that suggests that this can be helpful, it's not my preferred way of treating it. Now, I'm a big believer of looking into the anatomy of different components of our body, particularly when it comes to muscles and sinew-like kind of fascia that we're talking about here with the iliotibial band. Now, the way that the anatomical makeup of these, so not anatomical, the biological, makeup of these different tissues is very different. So the muscle, it's obviously a very contractile tissue. It lengthens and shortens, and obviously that's how we create movement. Whereas the ITB is actually quite a tough, the way I explain it, and excuse my morbidity here, but the sinew on your steak is very similar to the kind of fiber that we're talking about when it comes to the ITB. So the way I like to treat this from a symptomatic relief point of view, so pain relief point of view, is by actually releasing the muscles that attach to the ITB. So instead of trying to work on the ITB itself by rolling and foam roll up and down it, I see a lot more results from getting in there and stretching your hip flexors, in particular the TFL, or using getting a great massage or even a trigger ball into that area, and also the glutes. So working all the way through the glutes, just finding those tight pockets where the muscle is just not letting go, and kind of applying a pressure. So I say about a 3 or 4 out of 10 is a really nice amount of pressure to apply to these muscles to try and encourage them to relax. That's the whole idea of this. You don't want to get to a point where it's so painful that you're trying to tighten up and resist that movement. Because if you think about that logically, it's almost the opposite effect of what we're trying to chase. We're trying to chase that relaxation of those muscle fibers. So the last thing we want to do is get nice and tense. So that's really how we're going to reduce the pain that's associated with ITB syndrome. But more importantly, in my opinion, we need to kind of look at what has potentially caused this to be the case. And this is where we start to get into an AUP or an exercise physiologist's favorite realm, where we start to talk about movement. Now, I'm a big believer that muscles don't get weak or tight for no reason. Obviously, weakness would usually come if we're not talking about a specific condition or a lack of innovation. It's oftentimes going to come from just a pure lack of use. Now, lack of use can come from obviously multiple different angles as well. It could be that you're a sedentary person. It could be an injury that's put you bedridden. But more often than not, it's actually a poor movement pattern or someone getting around, whether it be walking or running or sitting, more or less than they're actually meant to or they've been made biologically to partake in. Or they might do it enough or adequate amount, but in the wrong way. So a different or poor gait pattern is obviously going to change the angles. And if you guys have all been good boys and girls and listened to my previous videos, you'd understand that forces and angles is, in my opinion, the most important thing when we're talking about our musculoskeletal system. So if I was to be walking on the outside of my feet, it's a really great way to check this out. Turn your shoes over, have a look at the wear and tear on your soles. And if there's heaps of wear and tear on the outside of your soles, that's going to be a pretty damn good indicator that the way that you're walking is actually quite lateral. So you're putting a lot of pressure through lateral aspects of your leg, including the ITB, the TFL, and the glute med and other areas of our glutes that is not designed to take that load. It then tightens up and says, "Stop you, Toby, I don't want you to use me anymore." So it tries to prevent that by tightening up, and hence then the ITB syndrome kicks into gear. So done a lot of talking to kind of put it all together. We want to release those muscles that have been overused or potentially just weak and become tight. We want to strengthen our muscles that we're designed to use, so more glute max, and kind of utilize more of that push off in our gait towards the big toe, get our VMO involved, so the right aspects of our quads, and obviously then fix that movement pattern that has caused this discrepancy to happen. So to give you a bit of an idea, we should be pushing through our big toe, which is then going to activate all the way through the middle of our knee. So as we can imagine, the joint is designed to move like this, not like this or like this or anything like that, right? So by pushing through the big toe, we're actually going to move in the adequate way and create that nice balanced force production from all of our muscles around our quads. So quads obviously being 4 different muscles, hence the word quad, coming together. So we want to really make sure that they're utilized the way they are designed. All right, done a lot of talking, but I hope that's really helped out. And obviously going back to the treatment of it, we're going to release and stretch the tight muscles, we're going to strengthen the weak muscles, and we're going to look at the way that we're moving. Anyone who participates in lots of lateral erratic movement sports like netball, AFL, even you know the rugbies, rugby league or rugby union, where there's stepping going on, they're going to load up that lateral aspect of their legs and are obviously more at risk of developing this syndrome. All right, I hope that's given you heaps to think about. I really appreciate you joining me this morning. I hope you're all staying safe, and I look forward to catching up with you next week. Take care, my friends.